Hello everyone, this is Dr. Harsha Bharadwaj. I am a pediatric resident. Today, all we hear about is COVID, COVID, COVID everywhere, and everywhere we see COVID. And even our WhatsApp messages are filled with COVID. And there are so many people telling so many things about the different treatments about COVID. Everybody is coming up with their own protocols. Many of these things, surprisingly, are unscientific, and many are also very harmful. And another sad thing is that children are also being treated with the same drugs as adults. Children are not small adults. They require special care. They require their own treatment. So, today we'll be learning about the treatment of COVID-19 in children. We'll be discussing about the guidelines that are framed by the Ministry of Health and Family Welfare.
The first thing you should do when your child has any symptoms like cold, cough, or fever is best to visit your pediatrician or do an online consult and follow his advice. This video is just to keep yourself informed about the treatments available for children. So, as soon as you get the report, the RT-PCR or the rapid antigen test is positive. Based on the severity of the symptoms, there are three categories: mild, moderate, and severe illness. Children with mild illness will just be having a sore throat, cold, cough, or fever. These children usually do not need an admission and just need to take some rest. They need to be given adequate hydration and also feeding. Hydration in the form of water, coconut water, buttermilk, etc. can be given, but one should avoid cold drinks. And they also need to have good food. A frequent question is what food is to be avoided. In COVID-19, there is no food that needs to be avoided. Your child can consume a normal balanced diet. If your child has a fever, then paracetamol can also be taken. In moderate illness, the child will be having fast breathing. Fast breathing or rapid breathing is when the child's respiratory rate is increased above normal. All these children need to be taken to the hospital and they require monitoring. Some might even require supplemental oxygenation. In these children, there is a chance of secondary bacterial infections, so your doctor might choose to add an antibiotic. Even in these children, steroids are not needed regularly, but only when the saturation falls below 94% or the child is deteriorating very rapidly. Then, coming to severe disease, it is when your child starts turning blue, the saturation falls below 90%, the child is having difficulty in breathing, or is too drowsy, sleepy, or unresponsive. These children would require admission directly in the ICU. These are the children that would require steroids. Steroids that are usually prescribed for these children is dexamethasone, but your doctor can also choose to prescribe something else like methylprednisolone or prednisolone depending on the condition of the child. On the other hand, remdesivir, there is no trial data in children and it is not recommended on a regular basis. It should only be used when the child presents to us with severe symptoms within 72 hours of onset of symptoms. Otherwise, it is not recommended. Other treatments that are needed are like antimicrobials in severe disease and oxygen therapy. And sometimes these children might be requiring some ventilation also. And in older children, you can even consider awake and prone positioning. So, looking at this, you must understand that there are many treatments like doxycycline, Fabiflu, and steroid from the first day. All of these are useless, and also they might really harm your child. Hope you understand that children are not the same as adults, and they need specialized care by pediatricians. Please do share this important information to others, and hope this video helps save a child, and hope you have a great day.